My treatment philosophy is based on utilizing all of the most recent evidence-based medicine that I can find. I also don't like to limit myself to only utilizing medications. I think psychiatrists get a bad rap for that sometimes. We know that both psychotherapy and medications not only both work well to treat anxiety, depression, substance abuse, psychosis, and other issues, but actually in combination together, both psychotherapy and medications do much more as a group than each of them does individually. And my philosophy is utilizing everything possible that I know is going to help the patient, whether it be principles of psychotherapy like CBT, dialectical behavioral therapy or psychodynamic psychotherapy, or even the newest medications that have come onto the market that have been validated to work. My primary focus in practice and in research is with adolescent substance abuse, most often in combination with things like anxiety, depression, bipolar disorder. We know that those kids have a tendency to be more likely to utilize substances, and also kids that utilize substances are more likely to develop those type of problems later on. So developing treatment strategies to be able to treat both of the aspects of their care, substance abuse and psychiatric pathology, are really, really important. And that's what my current focus is on. I also have an interest that kind of goes hand in hand with that in student mental health, both high school students and college students. And the practice that I have, the referral practice I have, has many students ages 14 to 25 in it. MUSC is a fantastic academic facility, as well as having some of the greatest clinicians, not only in the Southeast, but in America and the world. We have world-renowned departments in the Department of Psychiatry, led by Tom Udy, Kathleen Brady in the Clinical Neurosciences Division. We're world-renowned clinically and research-wise. We also have students that actively participate in treatment. And by having students on your service and being an academic facility, that means that the attendings and that the teachers on the service, of which I'm proud to be one of them, have to be their best. You have to know the most, you have to be up on current literature, up on current data to be able to pass along that information to the next generation. And that's why institutions like MUSC are so special. I think utilizing your own research to change the way both you and other people practice is a powerful thing. And doing research in adolescent substance abuse currently, I'm hoping that some of the findings that we find about adolescent prescription and over-the-counter medication misuse and abuse will hopefully spearhead change in this population. And also not limiting yourself to what's considered everyday practices, I think, is important. Being at the medical university fosters in you the ability to ask tough questions, questions that haven't been answered yet. One of the questions that I have is, can you utilize the dramatic arts as a treatment modality for things like anxiety and depression and substance abuse in both adult and adolescent populations? If you were practicing by yourself and didn't have the support of MUSC, being able to pursue options like that wouldn't be possible. And supporting their faculty and supporting the research that's changing the way people think and practice, that's how MUSC is changing what's possible.